TopMedTalk.
Alrighty, well, hello and welcome to TopMedTalk. We're here on day 3 of the 2024 World Congress of Anesthesiologists. I'm Desiree Chappell, I'm your host, and I'm delighted to be walking you all through the last several days here, doing interviews from the booth, meeting some just phenomenal people from around the world. Today, we have an opportunity to catch up with a group of global scholars that back in 24, so 2022, whenever we were in New Orleans at the ASA, we had the opportunity, privilege, really an honor to meet, I believe, 6 or 8 of the global scholars that were in the city for the meeting. And today we're able to meet with 2 more of our global scholars here in Singapore. So it is with great privilege and honor that I am able to sit down with Naima and Jake. Thank you guys so much for joining us.
Thank you so much.
All right. So Naima, I'm going to start with you. Why don't you tell us your full name and where you're from?
My name is Naima Zakaria, and I'm from Tanzania, a region called Tanga, which is the eastern part of Tanzania. And I've been working as an anesthesiologist for past 5 years. I work in a regional referral hospital. So in Tanzania, we have like hierarchy. So there is district hospital, and then there is a regional referral hospital, and then comes the national hospital or more specialized. So we are like the bridge between the national and the district. So that's where I work.
Okay. And do you have a specialty that you focus on?
Yes, obstetric anesthesia.
Obstetric anesthesia. Wow, that's wonderful. Well, thank you so much for joining us. And I know that you've done a little bit of broadcasting yourself. Yeah. Can you tell us just quickly about that?
So I used to be 3 months ago a leader in my hospital. So as you know that as a leader, you need to advertise your work, your hospital. So do a lot of interviews, do a lot of talking to people, to the customers about how they find the services in the hospital, and to get their feedbacks, and to talk to the providers. How do they find comfortability, and so many other health aspects. So it's like talking from the providers to the caretaker to the receiver to the service itself all.
Wow.
And also educating it to the government. Yeah.
Oh my gosh, that's incredible. Well, congratulations on that work that you're doing. All right. We also have Jake. Jake, thank you for joining us today. Why don't you introduce yourself?
My name is Kpehe. Maimie. I'm a Liberian and currently undergoing anesthesia training at the American Teaching Hospital in Nigeria. I'm being sponsored by the WFSA. In my country, Liberia, there is scarcity of anesthesiologists, and the system relies heavily on foreign anesthetists and dedicated nurses. So the Liberia anesthesia capacity building project, a project I'm part of, is been sponsored by WFSA so as to bolster the anesthetic workforce in my country. WFSA has been sponsoring me for over the period of 5 years. Initially, it was an 18-month program for me to become a diplomat. 4 of us came to Nigeria. But after the 18 months, they decided that I actually start full residency program. And I started, and I've been successful to pass the membership program. Currently, I'm doing fellowship so as to equip myself and be able to go back and serve my country.
Wow, that's fantastic. And is there a specific specialty that you are interested in, or is it just general anesthesia care?
So for the program that I'm on the West African College of Surgeons, Faculty of Anesthesia, that we follow the curriculum. So when you do the membership, you do the fellowship, you're a general anesthetist. Then you could decide to specialize. But for me, initially, I wanted to do pediatric anesthesia, but I have some passion for regional anesthesia. So I'm yet undecided, but...
You can do a regional on pediatric patients.
I'll combine both.
They deserve good pain control, is what I finished. All right, thank you. Well, I wanted to start with you, Naima, just to tell us a little bit about what anesthesia care and surgical care is like in your country. You said you had different levels of the hospital kind of system. What does it look like in your particular facility, and what does access to care look like for the population of Tanzania?
Yeah, so if I talk about my region, we have 37 district hospitals.
Oh.
And they are all being scaled up to give theater services, ICU services, and EMD services. It's a good thing, but a scary thing for us because there are no providers there. So, like all this, I'm the only anesthesiologist as a specialist in the whole region, and my region has 11 districts.
And one district had 37 hospitals?
No. 37 is the whole region. And it's scaling up. It's going all the way to 60, almost 64, 65.
Oh, my goodness.
So you can imagine the burden of the work. So what we are, in generally, Tanzania has very little anesthesiologists. They have many surgeons, but anesthesiologists are little in number. So far, we are only 124, almost serving more than 12,000 million people.
Oh my goodness.
Yeah, that's a lot. Because of that, the government came up with, or the education body of the government came up with, was to train the anesthesia providers, which are the nurses who get 1 year or 6 months exposure. So once they get the exposure, they go back to their center, and because they're nurses, they're not recognized. So what happened was that what work I've been doing for the past 5 years is that working with WFSA, doing a lot of SAFE courses. SAFE is like Safer Anesthesia from Education. That's the long form of it. And we teach about obstetric, pediatric, and we are going to teach about OR also, Operation Theatre. But those courses have really helped nurse anesthetic providers to get more experience, more hands-on skill, but also advocacy at their center. So when you go to do the course, you get the leaders. You tell them this is what they are doing. So when they go back, they have a voice. They do work comfortably. If they get stuck, they can call you. So like there is a bringing them together with us. So we cannot be in every district hospital, but we can at least communicate with them. So
and ensure that they have the proper education and training that it required to take care of these patients.
Yeah, and we also do the mentorship through the same program. So we used to do the courses and then done. But then we came up like, no, we need to do refresher training.
Continued education.
Then do the mentorship. This is how we have been like working. But this is only like anesthesia part. When you talk about what is the status is that anesthesia is now improving, but the surgeons and the other people don't still understand. So we are coming with a program of bringing all of them together.
Multidisciplinary.
Exactly. As we say, let's walk together or walk together, the theme of this symposium. So it's like, bringing everyone together so everybody knows what each of them are doing so as to get that unity and the work going on. In other hospital, like my hospital, at least it's better because we are like around 28 specialists, different, not anesthesia. I'm the only anesthesiologist, but at least I'm there to train the nurses. I'm working there. But the other district hospital, they're very unfortunate. Not all regional referral, there are to around 28 regional referral hospital, and not all of them have anesthesiologists. So, specialized hospital, yes, the national hospital, there are many anesthesiologists, but not the other part. So still there is a lot of work to be done because as we are increasing the surgical services in the hospital, we definitely need to have more of the surgeons, more of the anesthesia provider, and as you said, the quality should not be compromised.
Absolutely. And by shifting, we just came from a consensus group where we were talking about task shifting and that it is appropriate when you appropriately train the individuals that you're shifting the task to. And in fact, can do some tasks at a higher quality, hopefully, when you're doing that the same thing over and over again and you have a narrow scope of practice. I'm a nurse anesthetist in the States. I totally appreciate where you're going in the country and knowing that there are not enough anesthesiologists to go around.
And they're so unfortunate. You won't believe they said, you teach us here, but when we go back, we don't have voice, doctor. Nobody listens to us. We are just nurses. I'm like, you're just not nurses. You are anesthetic nurses. It's different. So advocacy, talking to the government, talking to the leaders, That is at least in my region, they have voice.
They have a voice. Well, congratulations to you. I know that it's tough to find a voice and to advocate for that. So, well, Jake, why don't you tell us a little bit about your situation?
So I'm from Liberia.
Right. But you're training in Nigeria.
I'm training in Nigeria.
Yes.
So Liberia experienced 14 years of civil war, civil war. And afterward, there was Ebola that ravaged the health sector. So in my country, when it comes to anesthesia, we had no consultant anesthetist. So we occasionally had visiting anesthetists that stayed for a period of time and left. So there was this critical gap that was created. And Dr. Kpehe and Dr. Hassan Mohammed saw that apparent gap, and he decided to initiate the Liberia Anesthesia Capacity Building Project, a project that I'm currently on, and they were able to talk to the WFSA that consented to provide full sponsorship. So when it comes to safe anesthesia in Liberia, there's still a challenge.
Yes.
Because for most part of the country, the bedrock of anesthesia provision happens to be the nurse anesthetist. And as we all know, they are trying their best, but they need to be upgraded. And in order to have a wide range of surgery, complex surgery going on, you need a consultant anesthetist to be the majority of the cases, like complex cases, are usually flown out of the country.
Okay.
Yes. Because anesthetist is not, consultant anesthetists are not available. So that's the current situation. So it was based upon that we decided to come on the program so as to be trained, so that we can go back and be able to offer our own service to our people.
So do you feel that at this point there's, this is maybe a silly question, but the adequacy of the services that are being offered in the facilities that are in your area, in your country, do people have surgery there, but it's just not enough?
I think this couple of years, things have changed significantly. Currently, they have few consultant anesthetists, foreign consultant anesthetists that are fully employed.
Okay.
They are also involved in teaching nurse anesthetists and medical students. So the exposure we're denied during our medical school days, I think the new wave of medical students are now getting exposure to anesthesia, and it's very helpful.
So just for those other people who may be listening to this that might be interested in becoming a global scholar, what are some of the benefits of this program for you personally?
Okay, personally, the biggest advantage or thing which I've got through is a peace, is a sleep, is a satisfaction.
Yes.
So much, because through the scholar program, we get to interact with people.
Yeah.
You won't believe there was a region I'll not mention. I went to a country through WFSA as a scholar. And when I mentioned that I'm a Tanzanian, they're like, where is Tanzania?
Yeah.
Is it in Asia? I'm like, no, it's in East Africa. Do you know Kenya? Yeah, there is only Kenya and Uganda. I'm like, no, there is Tanzania also. So, telling people about your experience, sharing with people. People were so blinded with the... yesterday I was with a taxi driver, and like, you come from a place where you eat people? And I'm like, no. Oh my God. You have a wrong concept. He has watched some movie of Mogadasha, which he thinks that's where Africa. I'm like, no. So, see, correcting people's thought, letting people know that you do exist. These are the challenges. This is even, and giving hope to those who are even more underdetermined than you, that see, we have been able to reach here. Do you also try and go, and you will be able to reach. I always tell people that we are not recognized because we do not tell them we exist.
Yes.
So it's very important to show. Don't just see in the theater. Go outside. If there's something happening in the labor room, interfere, because you know.
Absolutely.
You know all the emergencies in the world. So if you know, then tell them, I know. That's when they will know you know. that you can help. So I think for me, it's been like a great opportunity. And also, while seeing that, okay, yes, I'm suffering, but when you see, somebody else is suffering more, you say, no, I can sleep.
Yes, it's true.
I can sleep and, give them hope, talk, communicate, come together. Those who are very fortunate, then they see you, they're like, oh, really, you have, okay, let's come up, maybe we do this. So it's like great exchange of ideas, exchange of experience, and also, well-being.
Yeah.
Because
yeah,
coming out here in a very stressful...
It fills your cup is what we say.
Exactly. Because when you see, imagine you're in a situation where you have to reuse the ETT tubes, it's not good, but you have to do. And then that a patient will die because there's no blood. It's stress. This is stress, So it's like coming out here, seeing people, it's somehow like discouraging also that world has gone so up.
I know.
And you're still there, but still, there's a hope. There is hope. The Rome was not built in one day.
That's right.
So I was just told today, that we are 68 scholars.
Yes.
From 37 different countries. Imagine when I said that I'm fortunate, and when I saw all of us, and I'm like, wow, what a wonderful job WFSA is doing.
They are.
It's excellent bringing every one of us here.
Yeah.
Like, it's not easy. And I think this year is the highest number of the scholars we brought to Singapore, which is an expensive country.
Yeah.
But they did do that, and it's God bless them for that. But bringing us all here together is wonderful.
And it really can't be done without the support of colleagues, anesthesia colleagues from around the world who are giving and helping to make all of this happen. So if you are ever compelled, this is a wonderful organization to give to. In closing, Jake, what about you? What are some of the things? What an incredible experience to be going to Nigeria for training. I'm sure it's tough to leave your family and friends, but what do you think?
For me, I just think the sacrifice worth it. Even though there were some challenges along the way, like the first has to do with cultural shock. We're living from an area where we have predominantly Christian setting, to an area where you have predominantly Muslim. But the people in Kano were very welcoming. They've become my second family.
Nice.
Seriously. And another problem has to do with family. Like for me, as soon as I got married, I had to come on the program. So I got separated from my wife, MIK. And I get to see them once annually. So exactly. So subsequent batch of students that may likely benefit, we can ask the WFSA to make provision for families so that what I experienced, they don't have to experience it also. One person that actually impacted my life so much, he's dead, is the late Dr. Kpehe. He worked 31 years on Mercy Ship, and he traveled Africa, saving people, helping people, teaching the safe obstetric course. He was a mentor to me, and he was a father and a friend, and his legacy lives on in many of us that he impacted that much. So WFSA has been incredible, especially Secretariat. Laurie, Lauren, Alma, they're like family to us.
Yes.
They are very fast to respond to our builds. As she said, I totally support what Naima said. When they treat you, you feel you are the only one they are treating, like the personalized treatment.
Yeah.
And that is very laudable. I want to say thanks to them. For the Congress, it's my first time. It's my first experience. I never knew I was saying this because it was just amazing, mind-blowing, mind-bending.
Yeah.
The first day I came, because I actually scheduled the ultrasound masterclass before coming.
So?
When I came, I didn't know that you have to pre-register for the masterclass.
Yeah.
So when I came, I was at the door. I never pre-registered, so things got complicated. But as God will have it, everything got covered, and I actually did the ultrasound masterclass, and I thank God. Everything has been amazing. Most of the sessions I went, it was very educative, very informative, and I think it will carry me a long way informing my clinical decisions.
Yeah, I'll have to.
So in closing, I just want to say a big thanks, internal thanks to the WFSA that have been there for us, supporting us through all these processes. I also want to say thanks to the hospital that I'm currently training at, the American Teaching Hospital, for creating that space for me to acquire knowledge, skills, and expertise. Not only me, my colleagues who have also benefited, we say thanks to them. I want to say thanks to the Medical Association, like Nigerian Society of Anaesthetists, the Liberian Medical and Dental Association, the Ministry of Health of Liberia, because it's through them they've created an enabling environment to successfully carry out this program. And I want to say thank you for having us. It has been wonderful talking to you.
Of course. But it's my pleasure, and like I said, a privilege and honor to support what you guys are doing. The way we look at it, and I think, our listeners would agree that, supporting even one person from your country, the impact that it can have on so many lives, it will be exponential. And I can see that in both of you as leaders within your countries in the world and field of anesthesiology. So congrats to you for taking the leap and joining this wonderful organization, and good luck.
And we would like to say thank you, very much thank you to the Society of Anaesthesiology of Singapore. Everything they've organized, it's super. We are hosting AAA 2027.
Yes.
I don't think so. We're gonna reach this. This is excellent. It's your first time to be here.
Also the government
of Singapore. The entry was so simple. It was not complicated, and the stay is it's safe. The people are so friendly.
They are so.
In the morning, a driver gave me a pepper frog. And it was so nice. A pepper frog is like, you can just flip it and it flies. And it's so nice. So this is how people interact. And everybody's talking about all the drivers. They're so proud of Singapore.
Yeah.
So, it's wonderful.
Yeah. Let me just come in. When I entered, the driver that I met, it's like he gave an entire rundown of the history of Singapore, the garden city, the green city, how horses are built. They've been very, very friendly.
Yes. The same driver gave us the same.
Thank you so much. Thank you for all you're doing for your country and your people, and for us by sharing your stories. And safe travels back home.
Thank you so much. And we say in Tanzania, Karibu, Tanzania, means welcome to Tanzania.
Thank you so much. I will hopefully one day make it there. So thank you. And thanks for listening to TopMedTalk. You can always find us at TopMedTalk.com, our website. That's all of our podcasts. We're also on social, LinkedIn, Facebook, X. We are there. And we have a YouTube channel, whether or not you knew that. We do. And go there, subscribe, give us a little thumbs up. That always helps us out. Take this message that you heard today and share that with friends and colleagues from around the world. We really feel like it's important to support this wonderful organization and our colleagues from the globe. So thanks so much, everybody. Cheers.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe, check us out on YouTube, and of course on social media. We're on Instagram, Facebook, and X. Also, it's important to remember that TopMedTalk is the broadcasting arm of EBPOM, evidence-based perioperative medicine. We'd love you to find out more about that, and the way to do that is ebpom.org. Check out our website and find out about some of the incredible conferences we're going to be arranging across the year. ebpom.org.